So with that, I'd like to recognize our first person, Lieutenant Governor. I'll be honored to be able to receive the testimony.
Thank you, Mr. Chairman and ranking members. My name is Jeff Colyer. I'm honored to be the Lieutenant Governor of Kansas. I'm also a practicing physician who every day, this past week, for example, has operated on people without insurance. And we take care of them every day. And so this is something that's very personal to me. Like most states, Kansas is facing problems with the Affordable Care Act. It is a drag on Kansas businesses. A July 2013 Gallup poll suggested that small business owners revealed that 41% of business owners said that they were going to hold off on plans to hire new employees because of the Affordable Care Act. And in Kansas, that trend is no different. Wherever I go, the biggest concern I hear is the uncertainty about what the ACA is going to do to small businesses. And in a new development, since my testimony was written last week, it affects businesses such as mine. I'm a sole practitioner. Just yesterday, we had to sign a contract for $3,400 to rewrite all of our compliance manuals to fit in with the ACA. All it does is continues the same HIPAA requirements that we had before, but we just have to have a new form of documentation. It is something that doesn't change what we do, but it certainly costs us from new equipment, new jobs, and from taking care of our patients. And so I think you're going to see this everywhere in a lot of different places. Another Kansan named Mike Bergmeyer of Shield Agricultural Equipment in Hutchinson, Kansas, said that he can't grow his company beyond the 44 or 45 full-time employees because he needs to avoid the mandates that require companies with more than 50 employees to meet the ACA's requirements. Mr. Bergmeyer's situation is not unique. The Affordable Care Act is a drag on the economy like ice is on the wing of an airplane, preventing it from taking off. This is damaging to everyone, especially the middle class. Now, there is some other issues on operability. One place is where the states and the federal government interact to determine eligibility for Medicaid and for the individuals on the exchange. Our state is significantly advanced in doing that, and we have a very good, very strong working relationship with CMS, and a very positive one. Now, as recently as September 6th, I said in my testimony, but we've now heard on September 13th, there are a number of additional technical updates that keep disrupting the time completion for this. In fact, it appears that there's going to be an additional update coming up even before the October 1st deadline. And so that's going to make it very difficult for every state to do that. We're doing our best that there is. But then there's also this contradiction that is set up in determining eligibility. For Medicaid, Kansas and every other state, they've got to look at a person's real income, and if they don't verify that, we would lose federal funding for our Medicaid program. It's very hard for the taxpayers to have confidence in a system where on the exchanges, we have an honor system in the first year to verify income. And so it is really a strong dichotomy that I think undermines a lot of confidence in the system. Another issue that we have is dealing with the education and outreach by the federal government. Just recently is when the Navigator programs receive their contracts. As yet, they're supposed to be set up in order to know how the system runs, and we just learned who are those navigators going to be just a few weeks ago, and yet the system is still not able to go live today, and so that they could even practice and be fully formed in it. Kansas has not passed a number of laws about the skill sets of the navigators or anything, partly because we didn't have all of the regulations that had come down. There's also an issue of rates. It is going to be very expensive for us. One of the things that's there is in the state of Kansas, our exchange is only going to have 2 insurers on the entire exchange. 2 insurers. That is not more competition, that's less competition. And in fact, in Kansas, you have more choices in Medicaid than you do in the federal exchange in the state of Kansas. And so we've looked at a number of the price issues and things like that, and it is going to be a challenge for people. Finally, as a physician, I see this every day. I visit with my colleagues, we work together, we serve the uninsured. We've done that before, I've been doing it for 20 years, we will continue to do it in the future. This is not going to solve those issues. This is not going to make healthcare more affordable. In fact, it sets up new bureaucracies like the $3,400 that I have to spend just now. It doesn't make healthcare necessarily better. We can do a much better job, and it's best left to the states. Thank you.